Welcome to Chamber Talk, brought to you by North Orange County Chamber, where we explore the stories and insights of leaders, business owners and CEOs from various sectors who are making a difference in our community and region. Whether you're tuning in via podcast or joining us via video, we're glad to have you here. This guest is someone whose work impacts women, families, healthcare and even workspaces in ways we don't talk about nearly enough. Dr. Jenn Roelands is a double board certified OBGYN, integrative women's health physician, medical advisor, speaker and educator with a strong focus on hormonal health, perimenopause, and preventive medicine. Dr. Jenn, thank you so very much for being here today. It's a pleasure having you on our show.
It's a pleasure to be here. Thank you so much.
So I just wanted to share to the audience before we start that if you want to know more about Dr. Jenn, you can visit her YouTube channel. It's at Jenn MD. She has well over 26,000 subscribers there and loads of videos. So we don't want to sort of harp on with what she shows you on there, so today's a little bit different. But I'd like to start off with asking that, you've had a long career in the traditional, obviously, OBGYN leadership roles, consulting, and obviously now a very integrative prevention-focused practice. What drew you to the Pacific area of women's health, and how did your perspective evolve over time?
Yeah, so I grew up in a traditional Italian family where women were not to get an education. In fact, my mom got married at 16 to my dad at 18. And my parents were, very much like, you finish high school, you get married, you have babies. That's what you're sort of destined to do. I'm the oldest of 27 cousins. And I am the only one who went to college besides my sister. So I grew up in that sort of atmosphere where we weren't supposed to get an education, but I got through high school and said, now what? I'm not married. Now what am I going to do with myself? So I went to college and I really got drawn to science classes. And I really enjoyed that field and didn't know I wanted to be a doctor because I had no doctors in my family to be. I went as a Navy kid. You just go to the Navy and the Navy base and you sit there all day and wait for your
the doctor's office.
Healthcare appointment. Yeah. It's not a traditional office in any way. So I had no idea what it meant to actually go to a doctor. Mm-hmm. And certainly had no doctors in my family. And when I graduated from college, I decided to go to Central America and do research on parasites and all kinds of ecology type things. And while I was there, I kind of had this moment that said, I really love working with people. I really love science. I should apply to medical school. So I took a very non-traditional route to get to be a doctor. And I ended up applying and just continued on. And women's health for me was an avenue where you really get to have an intimate relationship with someone. You see them when they're younger, then they get married, then you deliver their babies, then they may need surgery later on. It's this kind of evolution where you get a chance to really be part of their life. So it was for me the first baby I delivered in medical school, I was hooked in it. And that was it for me. I just knew that was going to be where I ended up in women's health ultimately. And like most doctors, I started traditional medicine practice. I was with 11 other doctors, continued to, deliver babies and do the traditional GYN thing. And then I started having patients that would come to me who were in their 40s and say, yeah, this perimenopause thing is no joke. How are you going to help me? I might lose my job because I can't think right. My husband's upset at me for not wanting to be intimate. What do we do here? And I found myself constantly saying, well, I don't have an answer for you. Aging is, you just got to suck it up.
Right.
So I ultimately ended up, saying there's got to be other things we don't know in medicine, in traditional medicine. Maybe what you eat matters. Maybe the type of exercise matters. Maybe hormones matter. But none of that was taught in medicine. We only had about an hour of nutrition in medical school. So it kind of made me go outside the box and start teaching myself about what it meant to food as medicine. What did it mean to look at someone in their 40s and say, actually, now you got to do things a little different. And so it kind of went through many areas. I was helping women get pregnant that I wasn't able to do before. It was in multiple areas of women's health. And so I realized this is the type of medicine, the preventative, proactive approach as opposed to reactive that I wanted to do in the future.
Now, listening to that, it sounds like you were quite well, it sounds to me like you were sort of a pioneer in this field. Would it be fair to say that it wasn't generically known everywhere, and this is something that you really did have to figure out yourself?
I did. Functional or integrative medicine is much more accepted in California. I was in the middle of the Midwest.
Okay.
So, and if you look at board certified OBGYNs in California, there's only 5 of us. So it is still a very much on the forefront. Longevity medicine in general is a new concept. And so it's not very common as an OBGYN to do functional or integrative medicine because delivering babies takes time.
Right.
And to learn a whole nother science and to learn nutrition and to learn supplements and acupuncture and herbs and wearable technology, you just don't have that time when you deliver babies. So there is only 5 of us in the state of California that are board certified integrative medicine OBGYNs, and 2 of us in Southern California besides me. So, it's not very common, and hopefully I'm hoping that the future of medicine will be more proactive as opposed to reactive.
Now, I'd like to ask you a few questions touching on that, but just before we do, I would love for you to share with people, because it's so easy. It rolls off your tongue. There's only 5 of us here and there's not many people who do it. But I'm sure it's not one of those things where you just send in a little certificate or exam paper and then you pass. Do you mind walking us through how much effort you had to put to do that?
Yeah, so there are different kind of areas of preventative medicine. Lifestyle medicine is something that people will study on their own, and they usually it's about 6 months to get certified, and it's teaching pillars of lifestyle medicine. Then you have functional medicine, which is also a certification. So it's something that you do on your own, again, with classes through some institutions, and it's about 8 months to get certified. Board certification, where I had to sit in front of someone and take a test and do oral boards, is a 2-year fellowship. So it's 2 years learning about nutrition, acupuncture, herbs, supplements. I learned men's health, so I actually see men too and do TRT. So it's a much bigger entity, and then you have to sit in front of your colleagues and make sure you know your stuff. So there's a written exam in order to be board certified. Just like when I became an OBGYN, I had to do all that. Right. Yeah.
That's a lot more effort you have to put in to have your own practice rather than just going through life, isn't it, really?
Exactly.
So, on another side note there, obviously some of the things that I read about is that often women will go and have their blood work done and the labs come back saying it's normal. My mother hated that word normal, but it's normal. However, they still don't feel well. Mm-hmm. And, not putting a slight on somebody's doctor, but when would an individual think, well, hang on a minute, I'm still feeling this and I'm not changing, when you maybe ask for a second opinion, or when you should actually think about, well, maybe it isn't me, there is something wrong, and then they would approach a different approach to their medical?
Yeah, so in traditional medicine, we're really trained to do lab work and to diagnose a disease. Okay, you get a blood test and you say, yes, now you're diabetic, for example.
Okay.
We're really not trained to understand the pre-states getting there. We're not trained to go, oh, actually, this is a little abnormal. It's not optimized. Therefore, she's on her way. She's a pre-diabetic, or she's on her way to having an issue. We wait until it comes up abnormal and say, okay, now you're diabetic. But so it's kind of the concept between what's normal and what's optimal. Right? We could use this not in medicine. We could look at the back of a container of food, mm-hmm. and it says the RDA, which is the minimum amount that you should be eating in one day, right? So it's percentage, say, protein or whatever it is. But that's not optimal. It's a difference. So you could use it in any sort of term between what's normal and what's optimal. Like, for example, vitamin D. Vitamin D levels in most labs, 18 is the minimum, but that's not optimal for someone. People can have still symptoms when they have a low vitamin D at 18, much better if it's over 40. So there's sort of this kind of concept of normal versus optimal. With women on hormones especially, is because the range of normal is huge.
I bet.
If you're premenopausal or perimenopausal, your range of, say, estradiol could be 20 to 500. That doesn't mean that the person at 500 feels fantastic and the person at 20 feels terrible. Well, the person at 20 probably does feel terrible, but there's no sort of, it's just too big of a range.
Sure.
So you kind of have to look at it more, in my mind, the way that I practice is more like, let's prevent the thing from happening. So when I'm working with patients and they say my labs are normal and I feel terrible, it's like, well, you might be one of these pre-states that we don't recognize as a disease because we're very much driven in Western medicine to say, here's your diabetic, here's your meds. And we're not really sort of like driven to say, oh, you're kind of getting there. Why don't we shape up your diet? Why don't we work on what you exercise? Why don't we work on understanding your biology to figure out why you have blood sugar issues? So it's really a difference in kind of those steps leading up to it. I think that a lot of patients will say, I know they said I'm normal, but I don't feel normal. I don't feel good. I don't feel like myself. And that's kind of where this type of medicine lives.
And, we touched on it a couple of times, and we're sort of like coming back a little bit more to this preventive medicine. How do you, because, you're seeing this daily, how do you see the differences of the cause and effect of what you're doing now compared to what you had done maybe previously?
Well, I have better answers now for those patients that are like, now what? Now what? I don't feel good. This is affecting my life. I have a better approach to say, well, let's dive deep to figure out the why. Why do you feel bad? Right. Maybe, and even when it comes to ordering labs, we have sort of this set type of labs we order in medicine, but sometimes we don't look at someone's iron level or their vitamin D or these other pieces because we don't have an answer to it. So we don't always have a medication or an answer, so sometimes it's nutrition based and we don't learn that. So it's hard to order something if you really don't understand what to do with it afterwards. So I think those patients are really, in my mind, are the ones, I love the mystery ones to say, maybe there is something here. And also I think most women are really getting much more, like they understand that concept of like, I not only want to feel good now, but I want to feel good in 20 years. Like, how do you keep me? A lot of women come in and they're like, I don't want to have a hip that I fracture and like my mom just did, or my mom has bad dementia and I really don't want to end up like that. What are the things you can do to help me? And I love that kind of consult because for me, that's the way I think about medicine. It's not just let's get you feeling good now, but also what do your bones look like? What do your muscles look like? What's your brain look like? Let's not end up in the same situation if we can prevent it.
Now, you mentioned obviously perimenopause and menopause, and I'm sure a lot of women may know the difference, but if they don't, if you could explain that. And then, is there an age range that people would fall into one rather than another? And I'm sorry, I certainly don't know, so I'm
That's
asking
okay.
that question.
Yeah, so menopause is when you've had 1 year without periods. So, and it's literally described as that day. And in medical school, I always thought of it like we entered this door, like gumdrops and rainbows, and like, you've made it. You're now the most mature person in the room. Like, and then the day after is considered postmenopausal. It's like that day is the day we had 1 year without periods. Prior to that, leading up to menopause is this perimenopause transition, typically 4 to 10 years. So the average age of menopause is 51. So you can have people experiencing perimenopause as young as 31.
Oh, wow.
I mean, 41 too. Like, it depends on when they were destined to go, right?
Right.
Most people notice they start having symptoms in their 40s. And they kind of go, what's up with this? I'm waking up at 4 o'clock in the morning. Why do I feel like my mood? I feel a little ragey, like my teenager. I'm having these sort of, I just don't feel like myself, because they're starting to experience those decline in hormones, and that's that perimenopause transition.
And when you said there's obviously a period, and you mentioned it's like when it's your time sort of thing, is there a way, as a doctor or in medical science, that somebody could, through these tests or these more assertive blood tests, that you could determine when somebody may be getting to that stage? Or is it just depends on how you're feeling and what's going on with your body? Yeah,
we don't have a good test for perimenopause. We don't, because our hormones are going all over. They're a little bit of a roller coaster during perimenopause. There's no way to like say, yep, you're there in there, because again, I told you those ranges are really big, so it's hard to sort of know. So ultimately it's symptoms and then what's happening with your cycle. So if you're starting to have cycle changes and perimenopause symptoms, you're in the right age group, you're likely in perimenopause. There's not there's kind of this right now direct-to-consumer drive where they're trying to develop tests to say, oh yeah, you pee on a stick, for example, and now you're in menopause. So they're working on these things, but in order to determine when you will, some of it is lifestyle, some of it is genetic. So when did your mom go through menopause? Do you tend to have people younger in your family who seem to do it earlier or later? But certainly someone can be genetically, say, meant to do it at 55, but then they ate really terrible. They went through it at a different time because of lifestyle choices. So we don't know. We don't have a test yet that says like, I'm going to swab my cheek and guess what, Jennifer, it's going to be 50.
Right.
But who knows? The future's bright. Who knows?
So would it be fair to say, from what I'm listening to and understanding a little bit, would it be fair to say that it's not all really down to maybe when somebody does lab work, that maybe their hormones are different that week, that period, compared to another? So you probably should do a set because your body changes all the time, sort of thing, right?
Yep. So we call this like the roller coaster of chaos, right? It's just like up and down, because that's really what's happening in the body. In the body, the brain is telling the ovaries, please make hormones like you've been doing it for the last 20 years. Right. And the ovaries are like, if anybody's ever had a person in it who's about 2 years out of retirement working with them, they know how sometimes there's some good days that get some work done, and sometimes it's a little bit less, because you're just the ovaries are still saying, well, I don't really want to do this because I don't really have these follicles to develop anymore, so why would I have to put out these hormones? So it is a little bit of a roller coaster during that time. But more importantly, women don't have to get blood work to be diagnosed with perimenopause. They can see their doctor, tell them the symptoms, tell them what's happening with their cycles, and ultimately still get on treatment without having to require blood work.
Now, you mentioned something there, obviously, about the brain telling your body to make ovaries and things like that. And I'm assuming, because I know my wife experienced this, everything seems to be coming back normal in the blood type, but yet she couldn't, become pregnant because there are other things going on. How does one determine that it's not necessarily during the fertility time that there's something wrong, there's something else that needs to be looked at, or something that's going on inside you?
Yeah, so there are a lot of other things you can test for besides just hormones. So even if someone comes in and they think all their symptoms are related to perimenopause, I still always look at their thyroid. I still always look at nutrients. Because I practice whole body care, whole person care. It's not about just one piece. So most women get a full panel of blood work because we also want to optimize the other things.
Right.
Doesn't do me any good if I give someone hormones for their perimenopause and they have a very low vitamin D and they have brain fog, hair is falling out, all the symptoms of low vitamin D. I still got to fix that because it's still part of how they feel,
right,
and what they're doing. And I take that kind of whole body approach even in the aesthetic portion of my practice. I do aesthetics as well, and someone doesn't just come in for a clear lift for facial rejuvenation. I'm like, hey, what kind of vitamin D are you taking? Hey, I want to know the bigger picture because healing the inside is important for aesthetics as well.
Now, you mentioned thyroid there, which I know is it's more known today than maybe it was some time ago.
Yeah.
And it does play a big sort of like difference in one's life. Do you mind just explaining a little bit what people might be feeling, seeing, or how it really does affect our whole body?
Yeah, thyroid is kind of a master hormone. It's in every system. So it controls your temperature, it controls your metabolism, it controls even your heart rate. It's a master hormone. So when women have low thyroid, the most common classic symptoms is they start gaining weight, they have brain fog and fatigue. It's nothing like any other fatigue you can describe. They could have 6 cups of coffee and still feel wiped out.
Oh, wow.
Hair falling out. Some women get hot and cold intolerances where they're sort of like, what do you mean it's hot in here? They're just kind of off on their temperature. And hypothyroid or low thyroid function is more common than hyperthyroid. But hyper is the opposite. So they get racing heart, they sweat frequently, they lose weight typically, their hair does fall out too. Hair is kind of there's multiple hormones that control hair growth. So, but yeah, thyroid function is kind of part of routine Western medicine to get thyroid testing every single year over the age of 40. And I do a full thyroid panel because to me it's more important that I know what part of this is working or not. So I always do a TSH, T4, and T3, and then thyroid antibodies because I want a bigger picture. I'd rather, again, pick something up before. Yeah, before they come to me and they're like, I have horrible constipation, I've gained 20 pounds,
right,
and I'm exhausted,
Is part of this, or part of the part of the problem could be that maybe somebody's in a position where they have a lot more stress in their life, or could that also push this in a different direction, or is it quite normal? I was thinking about something like that, or am I way off target there?
No. I mean, stress is a huge factor. A lot of patients that I talk to, we have to kind of go over, because everybody has stress in their life, but the question is, how is this stress manifesting in your particular health?
Sure.
Right? So I met a gentleman probably about a week ago, a new patient, and we were talking about all the symptoms he's going through, and I asked him a very simple question, like, how much do you sleep at night? And he said, well, about 2 hours. I said, okay, step one, we need to understand how this is really affecting the fact that you're exhausted all day, your hair is falling out, your brain's feeling foggy.
Right.
Like, so part of why he's only sleeping a couple hours is he's up at, he gets home, he takes care of the kids, eats dinner, and he goes onto his computer to do work till midnight or 1.
Right.
Then you can't get to sleep because your brain's still thinking about the 10 emails I didn't answer, even though I answered 30, right? So for this gentleman, it was really important for me to kind of talk about, okay, this is going to be a big problem. It doesn't matter if I give you testosterone or I give you these things, it's not going to work as good as until we have your lifestyle dialed in.
Right.
So let's talk about what can we do to change that. Why do you need to do those emails at 10 o'clock at night? And so, those are things that I kind of help people work through to realize how much that impacts their health. By being up till 10 o'clock with your computer screen on and your cortisol up and your melatonin's down when it should be the opposite, it's now messing up your testosterone. So it's very much, I call cortisol sort of the great wrecker, because you can have everything else right, and then, your cortisol is high because you're super stressed out. College kids can tell you this, right? College kids can tell you that finals week, they eat terrible, they don't sleep, they drink a ton of coffee, then they come home and they all get colds at home when they're with their parents because they've burnt everything out and their system is just, struggling.
So as a big part of your practice is a preventive medicine.
Yeah.
Excuse me. What sort of lifestyles could younger folks actually look at putting into their life that would assist them as they're getting older? Not that nobody's going to listen, but like what should we be doing?
Yeah, even 20 and 30-year-olds, I will often talk about, they're not looking through the lens of things falling apart yet, right? They're not in their 40s, so things work pretty well. But a lot of younger folks are super interested in wearable technology. They want to understand, they're kind of more biohacker. Like they want to understand what makes them different than their friend. What makes them different, like if they eat low carb, is that the right diet for them? Now with genetics, you can do swabs of their cheek and say, here's what your genetics say about the diet that works for you, exercise that works for you, the types of supplements that you should be because you're missing these nutrients. So a lot of younger folks I find really like that kind of longevity perspective because they're not feeling the symptoms that are, unless we're talking about fertility specifically, but a lot of them will want to know, like, well, what is the right exercise for me? Like, what am I genetically built to do, if that makes sense? So I think with the younger folks, I do a lot of genetic testing. And also for them to understand some of the habits that they get into now will be the ones they're going to need to do
later on.
Yeah. So I think that, when you're suddenly you're 45 and you go through perimenopause and you're like, I've never eaten healthy before, it's a shock. But if you're 20 and 30 and you understand what fiber is and you understand what, a good, healthy, balanced plate is, you're going to do much better when you got to be a little bit stricter on what you eat in your 40s. So I think that's always important to make sure people know what healthy habits are.
And, there's a lot of information out there and nobody really knows. If you're looking through it, how do you decipher? What to you would you suggest as is healthy regarding exercise or how someone exercises? Is that also driven through, like you were saying, could be a generic type thing? How does that differ, or does it not differ for anyone?
It does differ. So if you were to do genetic testing, you could find out if you're someone who has like slow twitch fibers, fast twitch fibers, what kind of exercise is actually good for you. So when I did my genetics, for example, my muscle fiber types are better for long endurance type exercise. So I would be a good runner. I would be a good swimmer long term, which actually that's what I did in high school. I was a long distance swimmer. I was a cross country runner. Like it made sense. It kind of, I'm not the sprinter. You're not the one that you put me on for the 100-yard dash. So, you know, you can learn from genetics to see what you're sort of built to do. But, and also, you know, it talks about recovery. I mean, there's a lot of stuff you can dive into, but I ultimately tell younger people, like, do the exercise that makes you happy. Like 20s are about, and 30s are about figuring out, like, what do you like to do? What makes you get up to go do it, right? Because we're all tempted by sitting and watching Netflix and streaming stuff and watching all 6 episodes of Stranger Things or whatever. Like, we're all tempted by this. So what makes you get up to do it? Maybe it's ultimate frisbee. Maybe it's running. Maybe it's pickleball. I mean, what is the thing that gets you up to go do it that you love to do? And that's going to be how you establish these good habits too. Because if you enjoy doing it, you're going to do it. If it's like, I have to take spin and I hate spin and there's nothing worse than spin, maybe I'm personally talking about myself, like, then you're not going to do it. It doesn't matter how many doctors tell you you're not going to do it because you don't like it.
Of course.
So it's important for them to establish, same thing with eating, good healthy habits of not eating at 10 o'clock at night, trying to make sure you don't skip breakfast, making sure you're trying to add fiber. So for me, it's kind of like the low-hanging fruit for younger people. Like, what are the things that you enjoy doing and what can we add to that? So it's a more balanced kind of exercise routine.
And how does one go about getting generic tested?
Genetic testing? Yeah, so there's many companies that do direct to consumer, so they can actually go straight to websites and do that. Or they're ones that, if you're getting like a big genetic panel, most people will get it done through a doctor's office because they're the ones interpreting it for you. So if you're going to do a full genetics panel, then you would want someone who's going to read through the 70 pages and say...
And give you your full lowdown there,
like the blueprint.
Yeah, that makes total sense. That makes total sense.
Yeah.
All right. Oh, I'll let you get another drink there. That was good. So one thing that I was reading up on is there's a little bit of confusion and sometimes fear around hormonal therapy and supplements and treatments and things like that.
Yeah.
How do you sort of rationalize that to your patients?
You know, women's health is underfunded, understudied, and not placed in importance. Less than 8% of the National Institute of Health's budget is on women's health research.
Really?
We were not required to be in clinical trials as females until the mid-90s. So any drug that was approved prior to the mid-90s could do the whole randomized clinical trial and get approved through the FDA and did not have to have a single female in there if they didn't want to, because we were considered too complicated. So they would just consider us to be small men. So for example, you work on approving a statin, for example, you just sort of assume that they use smaller doses, but we're not small men. We have very different biology.
Sure.
So unfortunately, that goes with women's health hormone replacement therapy. So I was literally in a medical school when all this came out with the Women's Health Initiative study, which said breast cancer, you're going to develop breast cancer, a heart attack, or stroke if you use estrogen. That was and unfortunately at the time, it went out in the media before even doctors got any emails from the NIH that said, here, guess what, this study is coming out. So it just went very, there's no viral thing in 2001, 2002, but that's basically what happened. And so the message, doctors stopped prescribing, women stopped taking it, and it stayed like that for a very, very, very long time. And at the time, they also put a black box warning on estrogen and said, do not do this because it will cause breast cancer, blood clot, stroke. So in the 25 years since that study has been published, we have learned a lot from going back to that study. There was a lot of myths that came from there. First of all, it wasn't estrogen that was the issue at the time. It was actually progesterone and synthetic progesterone, which we call progestins. So the breast cancer risk was actually higher in the synthetic progestin group not the estrogen alone group. The estrogen alone group actually had a lower risk of breast cancer. But for some reason, estrogen has been villainized in this whole 25-year picture. So in the last 5-7 years, there's been a lot of doctors online who have really pushed the advocacy to say there's many flaws with this study. There should not be a black box warning on these medications. And we've used them for a very, very long time. In fact, most of us don't even use the synthetics anymore. We use the bioidentical version. So that study is very flawed because we don't even use that same regimen. And so this last year in November, the FDA finally removed the black box warning after 25 years.
Wow.
So it's fantastic because me as a prescriber a year ago, I would write a prescription for hormone replacement therapy. They would go to Walgreens. The pharmacist at Walgreens would say, no, it's going to cause breast cancer. You should not take this, because they had a black box warning. And then the patient would come back to me, I can't do it. The pharmacist says I'm going to get breast cancer. So I'm very happy that that warning is off, because it should be a conversation between the doctor and the patient.
Sure.
And not have false information that's misleading to the patient, because then they don't want to do it.
Right.
So I'm happy that has sort of changed the tide. I think now, to be honest, I think it's patient-driven, this desire to now have hormone replacement therapy, because we've realized there's flaws in that initial study. It's also driven by celebrities. There's some celebrities that are my age that are like, this is for the birds.
Right.
Halle Berry, Naomi Watts, Gwyneth Paltrow, like all these wonderful, beautiful ladies that are my age that are like, no. I'm not putting up with this. So they're creating their own companies. They're creating telehealth companies. They're pushing states to provide menopause care. There are 13 states that have bills this last year on that menopause care should be part of medicine. So there's a lot of advocacy happening. There's advocacy from the physicians to the FDA. There's the celebrities, and I think there's patients who are now like kind of going, whoa, I saw what my mom went through for the last 20 years. Can I do something different?
Okay.
I'm not interested in that anymore. Do you know what I mean?
Yes.
So I'm really happy the conversation has exploded online, and the conversation is out there, and women are, it doesn't matter to me what someone chooses. I just want them to have the choice. I want them to feel like they have the choice for what makes sense for them.
Now, you mentioned there were some myths,
Mm-hmm.
and I'm sure that's not the only myth. You mind sharing a few of your top things that come to mind about what we're all led to believe but might not be quite right?
Yeah, so more commonly doctors won't prescribe hormone replacement therapy until they're in menopause. There's no reason a perimenopausal woman cannot have hormone replacement therapy. It's a transition.
Sure.
So we're sort of taught in medical school, like, hormone replacement therapy is for a menopause women. So women will see me a lot and they'll say, well, I'm already having all these symptoms. There's no reason they can't. So that's one myth. Number two, people are told, well, you have breast cancer in your family, you can't have hormone replacement therapy. Completely false. Breast cancer is very common. It's 1 in 8 women.
Yeah.
There's not anybody I don't know that doesn't know somebody.
Sure.
So it's not a reason you can't have hormone replacement therapy. In fact, breast cancer patients can have vaginal estrogen. They can even have vaginal estrogen. It's safe for them. So it's incorrect to say that, family history is part of it. Third, I think women also get told by other women and even their moms that, like, going through menopause is natural. Like, you should just do it because it's natural.
Right.
I mean, having a baby without an epidural, is that natural? Like, I feel like women choose the epidural rate is 95% because it hurts.
Yeah.
It's much nicer with an epidural.
I'm sure.
You can do it. The baby will come out.
Right.
But why do you have to suffer?
Exactly.
I mean, having hypothyroidism, is that natural if your thyroid just gave out? Should we as doctors go, well, I mean, your thyroid gave out. I mean,
tough luck.
Suck it up. I mean, that's just natural.
Yeah.
You were going to die from something, but we don't, right? So why do we treat menopause women like that? Yeah. Why do we say to them, it's natural for you to feel like crap for the next 30 years? The average woman lives to 84, or 81.1, I'm sorry.
Okay.
I did a presentation on this last year. 81.1. So that means they're living 30 years, or a third of their life in menopause.
Wow. That's quite a while.
Yeah.
To navigate through all that.
Yes. Right? And it's not just about the symptoms, it's about their risk of not doing something. So the average woman not on hormone replacement therapy, if they get a hip fracture, 50% of those women will likely die in the first 2 years. The other 50% have significant mortality and morbidity long term because they have fragile bones now, right? You lose muscle, then you're more susceptible to falls. You don't have any estrogen to your brain. Guess what? Dementia is twice the rate in women than men.
Really?
Yes, fantastic book, by the way, The Menopause Brain, written by a neuroscientist, Lisa Monscani. And she was the first one to basically show that, we all are men and women are kind of equal when we're younger, and then suddenly we get hit with menopause, and this catalyst of lack of hormones really kind of pushes that to the forefront for women for dementia, for Alzheimer's. Well, Alzheimer's is one form of dementia. So, there's sort of this kind of concept of like longevity also with hormones. Like we're using it not just for, I want to get rid of my hot flashes, but I don't want to break a bone. I don't want to have Alzheimer's. I don't want to have muscle issues. I want my skin to look good in 20 years. Like it's bigger than that. Yeah.
So there's something you mentioned there that I've heard a lot, and it actually happened to my mother-in-law. But so she broke her femur later on in life, and of course everybody ultimately says, "Oh, well, you haven't got long to live now. You've done that," and you just mentioned something like that. So I'm assuming there is some type of prevention that you can help along those lines. Is that right? Is that what I'm hearing?
Yeah. So, you can find out your genetics, but you can also do a DEXA scan or bone scan. Medicine says don't do it until someone's 65. Okay. That to me is ridiculous. Why would you
wait that long?
Yeah, why would you wait for 14 years after they've had no estrogen?
Right.
I did mine at 46, and I already have osteopenia. I already have bone loss. So if I'd waited 20 years...
It'd be way worse.
I'd be way worse.
Right.
Yeah. So why are we waiting? The reason why this was created was the U.S. Preventative Task Force at the time said, well, we want to pick up fractures, right? We want to pick up problems. So we think it's worth paying for this test, right? So we do mammograms at 40 because we're trying to pick up breast cancers because that range of breast cancer starts going up.
Right.
And so they're like, well, fractures happen typically in the 60s, so we're going to wait to cover this. So I encourage all women in their 40s to get a DEXA scan. Depends on where you are in your perimenopause too, when to get it. Because then you can know, like myself at 46, I got to lift some weights. I got to do some lifting. I got to have collagen. I got to have vitamin D optimized. I need to do things to protect my bones. I use a vibration plate to help with bone so I don't end up in that problem in 15 years.
Right.
So to me, I think there's valuable information that we can learn from, what moves the needle, what keeps things steady so you don't have poor bone health when you're in your 60s. Because, women live longer than men. Men, on average, live to 78, 79. But we live longer in disability. So if you look at someone's health span, women will live 10 to 12 years, the last part of their life, in more disability than men,
right,
with more chronic illnesses. And that's because we lose that estrogen and then things just start to kind of pile up on it. And so I think there's lots you can do earlier if you're sort of taking that proactive approach about trying to stay healthy.
Now, I don't mean this as a plug. We've got a member, they're in Brea, it's called Ostra Strong, and they do this bone mass plate thing.
Yeah.
And it seems like, you go there and you're cheating the system of weight training for the day, but, he swears by the fact that you're actually building your bone mass up. Mm-hmm. And I'm assuming that's what you were talking about with that hover plate, because I remember you stand on it for a while. But is it also driven by, what you eat, maybe some type of medicines? Is it a mixture of things that you should look at doing prior to your 60s, clearly?
Yeah. You need nutrients for your bones. Your bones have to turn over. And so what OsteoStrong, for example, is, and I know them very well, you're putting stress on the bone so the bone goes, ooh, I better get stronger. So OsteoStrong is essentially, and I don't represent them in any way.
Yeah, no, I get it.
I have been there myself.
It came up.
Yeah, I've been there myself as a patient.
Sure.
And I know the owner in Brea. But basically, what you're doing is you're actually getting a marker, right? You're getting science and data to say, for me, I need to get to this mark with the stress. So those little weight training activities, you're doing them and you can see the little thing go up. It's like, yep, you hit. So
you're peaking, right?
You're peaking,
right,
yeah. Now, do you need that? There are, you can certainly lift weights and measure yourself with a DEXA scan to see, am I changing or not? But that's giving you a faster road map to that, right? Because you already know I got to get the level to this. I got to do this particular thing. So yes, I think places like that can be fantastic because they tell you what you need to do to build bone, to put the stress on the bone so the bone wants to turn over and be stronger, right? We do aesthetic things. We do these microneedlings because we're stressing the skin out because we want the old stuff to slough off and we want the good collagen and all that stuff. Same concept, right?
Sure.
You're putting stress on the bone. You're saying, I need to be stronger. Lifting weights is the same thing. Only difference is lifting weights, you're doing muscle and bone, right? You're really working on both and balance and all the other things. So, whichever way makes sense for someone to do, I think that's great.
Now, we mentioned breast cancer quite a lot, and you're right. Well, of course you're right. But, it's 8 out of 10 women. And often, things are, as you mentioned, what's your family history? How do we do it? You shouldn't take this drug or you should take that. Is breast cancer commonly a thing that is a trait from family history or genetics, or can it also be prevented because we're living a different lifestyle? Or, is it so open there? It could be anything.
This is where Western medicine and preventative medicine really deviate on cancer. Because breast cancer, genetic, so like BRCA or HERS or those things are not, and I'm not a breast cancer doctor, so I'm just sort of telling you from a general OBGYN, that's a small percentage of breast cancers. Of the overall total cancers, genetically linked ones are not the more common types.
Okay.
And so then it comes into the lifestyle piece, right? But in medicine, people are not doing randomized clinical trials that say, I'm going to take a group of 40-year-olds, and this group's going to have an anti-inflammatory diet, sleep really well, make sure they get good vitamin D. And then I'm going to compare it to these 40-year-olds and see who gets breast cancer, because the money's not in apples. The money's not in nutrition. A nutrition study, they just don't get done in medicine because, again, there's no pharma. Most studies are driven by pharma.
Sure.
So there's no drug to sell an apple. So it's, unfortunately, there's not these studies. If you look at a lot of publications like in nutrition science or frontiers in genetics, or you're looking at those kind of articles or those kind of publications, that's what their thing is to understand, that lifestyle is a huge factor. We know people who drink, who consume alcohol have a higher risk of breast cancer. Women who don't exercise have a higher risk of breast cancer. We know smokers. We know these lifestyle pieces that are a factor for having a higher risk of breast cancer. We just don't learn that in medical school. And again, because there's nothing driving that education. So there are definitely some studies that indicate that there are lifestyle things that women can do to prevent breast cancer. There's even some data that's coming out about vitamin D levels, trying to have vitamin D level above 40 to prevent some solid organ tumors. So there's stuff that's there. It's just not, it's not out there where most
not trendy enough yet for everybody to figure it out, or
just not in Western medicine, right?
Sure.
Like if you go to your standard doctor and just said,
I don't even think about it.
No. And you said, what can I do so I don't get breast cancer because my sister had breast cancer? They're going to just say, eat good, exercise. Like they're not going to give you any specifics because we're not taught that. So we can't really tell anybody that. I'm taught that because this is the world I live in.
Of course.
But it's just a different way of looking at it. I think, the consumers are clients and patients are getting much more savvy with finding this information. I think this type of medicine is becoming more popular because a lot of people don't want to be on medications lifelong.
Sure.
They decide,
it's not
do I
good
have
for
to
you,
be
maybe
on this IBS med forever?
Right.
Like, am I ever going to have a normal bowel movement? Like, they want to be off of those things. So I think hopefully that demand will also, become part of what we decide to do. And the more we learn about cancers anyway from a genetic perspective, I've been an OB/GYN for 17 years and breast cancer has drastically changed. We used to just give everybody the same cocktail of chemo, right? Everybody got the same.
Yeah.
Now we send their tumor off to get genetics and say, well, this cocktail is going to work for you.
Right.
Whole different ball game.
Sure.
You make people way less sick. You have less adverse outcomes because you're making it personalized.
Right.
So how great would it be that they sent also a cheek swab and said, now you should eat this. You're low in zinc. Like, how cool would that be? As your oncologist was like, because how many times, if you have anybody in your family who has ever had cancer, if you've ever been to any appointment with them, you know exactly what they say. Most patients say, what can I do? I'll do anything.
Right.
Like, what should I eat? What kind of exercise? What, they're really driven by wanting to feel better. So I think I would love for that to be the future of medicine, to be about personalization.
So I suppose what I'm taking from that is generic testing in this field would make sense for anyone, because it would teach you a lot, or a specialist like yourself, teach them a lot as what they can tell you and advise you of how to, well, do better in life, I suppose, right?
Yeah. I mean, I did my genetics, and I'm an ApoE4 carrier, which is a dementia risk. So I have a much higher dementia risk than the baseline. And so I focus a lot about my health being for brain health. What do I need to do so I don't end up with dementia? What are the supplements I need to take, the type of exercise, the food I need to take? What do I need to do to end up to keep my brain healthy?
Now, when you were talking a little bit about, when we were just discussing there about breast cancer and how there's so many different things that can affect it all, excuse me, I know this sounds like far out, but can the way one's life is, as how they don't sleep as much as they do, or maybe they quickly grab something to eat on the way out rather than sitting down and spending some time. Maybe they don't even spend some time for themselves just to relax. Can that really affect one's body and organs and things like that as well?
Yeah, so most of the stuff we learn in lifestyle is because there's this area of the world called, these are blue zones. If you've ever heard of blue zones.
Never.
Okay, blue zones are certain areas in the world where there's a high concentration of individuals living over the age of 100.
Oh, wow.
So there are multiple blue zones in the world. And so a lot of people who study, like, okay, what is the thing? Like, how do I age great, right?
Right.
And Dan Buettner wrote a book called The Blue Zone. And they're based upon these centenarian studies, which are and there's multiple centenarian studies that are different regions of the world. In fact, Loma Linda happens to be a blue zone.
Okay.
In California. Yeah.
Wow.
Yeah, kind of interesting, huh?
But isn't it?
There's a
What's
place in
going on
Costa
there?
Rica.
Is it in the water, or what's good?
Well, in Loma Linda, there are a lot of Adventists who are very plant-based diets, who have certain. So that is actually driven by that lifestyle, specifically of being, exercise, mental health, all those things. But what I found fascinating, if you look at those studies, because I gave a presentation last year on how to improve health span in women throughout the ages. So I had like a 20-year-old cohort, a 30, 40, 60. And what was very cool is they all have different lifestyles, right? If you're living in Japan, you have a very different diet than if you live in Loma Linda, which has a very different diet than Costa Rica. So they have different diets, they have different lifestyles. Some people are farmers, some people are. But the one thing that was completely universal across all of them was relationships. A purpose in life, and relationships. So there was one, they interviewed this super sweet older gentleman, and he was like 108, and he was like, and they said, well, what's the secret to not dying? And he said, well, I wake up every day and I just kind of forget. I have so much to do. My church needs me. My kids need me. My grandchildren need me. I kind of forgot to die. Like, I just have so much to do. He has a purpose in life. He has purpose. And even in Japan, they have this, a lot of them live in so that men may pass and then the women kind of live together and like a community. And they take care of each other and they support each other. And so your relationships and having meaningful relationships and having a purpose was universal across the board on all these different places. And there were certain things that, obviously anti-inflammatory diet, plant forward diets, those were certainly, throughout there. But I found that kind of fascinating because, there's so many, all these, biohackers online who are like, take these 80 supplements and, blah, 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 and sleep with these awesome glasses. And we can get so like in the weeds with stuff. And I just thought, wow, like having meaningful relationships and having purpose, like that's pretty attainable for all of us.
I suppose, if you think about it, I suppose it really fulfills your everything, isn't it? So I can see how it would help your body because you're feeling at a better, lower, sort of like less stress, I suppose.
Yeah, and it kind of makes sense if you think about if you've ever been in the room with someone who's passing or someone who's close, who's has very little time. They don't usually say like, "Oh gosh, I wish I would have bought those blue light glasses so I can prevent this." No, they're like, "I wish I had more time with my kids," or I wish I would have gone to Hawaii, or whatever.
It's things we missed that we weren't thinking were important at the time.
Yeah. I think that's kind of, my husband has an assisted living facility in Orange, and we often talk about that kind of, making those things happen that are important for someone to, die the way they want to. So there's a lot of things you can do for prevention, but also there's some things that sometimes are harder to get to talk to patients with. And a lot of times I have to kind of dive into those too and say, like, why do you wake up every day? Like, what's your purpose?
Right.
What drives you? Why do you make those decisions about what you ate today or exercise? Like, what is your why? And that helps too to figure out what are the goals someone wants to do too.
Now, you mentioned very earlier on that a lot of the pharmaceuticals, they weren't really designed with women involved. It was more, we'll take a smaller dose because they're smaller than a man. Leading into that, especially in the business world, do you feel there's a space in large corporations that hire thousands of employees that we're always talking about mental health, but is there a place there where we should maybe start looking at people's physical health and preventive medicines maybe, or maybe you should go for a checkup? Do you feel there's a space for that? Because we only talk about mental health. We don't really talk about physical often, do we?
Yeah. I mean, I think corporate wellness is definitely needed. And I think especially with women's health, because there was a really cool study done 3 years ago that said that there's quite a bit of women who leave the workforce when they start having menopause because their brain just doesn't think the same way. They're not as fast. Their focus is different. They're not sleeping very well. And so this is why this menopause care legislation is trying to be driven by in some states, because they want people to be able to almost like have it as an option for your health care through your employer. Like, let's kind of help you through it. Yeah. I mean, if you think about it, we have paternity and maternity leave, but we don't have anything sort of set up for andropause for men, menopause for women, for like these stages that can be very debilitating for someone. I mean, if they're sleeping 2 hours a night on end, they're going to have a hard time at work.
100%.
So why not support someone in that environment when they spend 8 hours a day with you, some sort of support in that way.
Now, just out of interest, if somebody's listening and they're now going to Google all this stuff and look you up and all the rest of it, what would you maybe share which would be easier? What would you share with your younger self, with now your future self, as to what maybe you should look out for, or how you should go about taking your health more seriously?
I think I would say listen to that intuition. If you went to your doctor and you did lab work or whatever, however the interaction happened, and you said, I just know something's wrong. I just feel like something's off. You just probably have to find the right partner that's going to work with you, right? You got to find the right person that's going to dig a little deeper, that's going to work a little bit harder to figure out what it is that's off. And so I would say don't ignore that, because some women will do that. They'll be like, oh, okay, well, they said it was fine. And then, a year goes by and now they feel even worse. And then they come to me and say, well, I've been dealing with this for over a year. And so listen to that intuition that says, I don't know, something doesn't seem to be right. I think the other thing is having conversations. So like, I'm in a sandwich generation. I have parents that are aging, that are starting to have health issues that I'm involved with a lot, but I also have 4 teenagers. And so I never really thought about I'm starting to have these conversations with my kids about, actually, you exercising now at 14, starting to exercise is really, really important because get to build bone until 30.
Right.
Use it, girl. Like, let's do it, right? These conversations about health, about, but they're a little bit more because they have TikTok, right? When I was a kid, there was no TikTok.
Of course.
We had the old school phone with the long cord.
Right. Or go to the library and look it up.
Go to the library, yeah. So I have a lot of conversations with my daughter, for example, who finds something trending on TikTok about some cosmetic or whatever. And so we talk about like what's clean ingredients in these things.
Well, that's good that she asked.
You're 14. Your hormones are up and down. I want you to use products that are, it's better to spend a little bit better money on a good product that's not going to lead you to mess your hormones up and give you acne. Let's talk about what that means to live healthy and what protein is in your diet and eating breakfast. And so trying to establish those habits, I think if I was younger, my parents didn't know anything. We were in the 80s where it was all just the microwave TV dinner. Like everybody watched prime time at 7 to 10. Like it was just a different world.
Yeah.
There wasn't access to information. So I think if I was younger, I would have told myself this is something when you set up these good habits, it's going to be better later on. So try to think about what you can do to feel at the top of your game.
Now you brought up a really good point there, because obviously you're right. Our world is so many different now, and everything we need to know is sort of don't know if it's what we need to know, but access to information is at our fingertips. Is there a particular website or a place where one can go and research what things are maybe good or bad for you, as in chemically? You mentioned makeup there. Is there like a list where you could say, oh, that's really not good and that's okay?
Yeah, so environmentalworkinggroup.org has databases. So they have a skin deep database where you can, and this is what my daughter does all the time, she'll find something on TikTok that's trending and she'll go, okay, Ulta brand lip gloss, what's the rating for clean product versus not clean product?
Okay.
So it literally has a database, but also the database for any product. So you want to know if your Mr. Clean sponges are okay, you can look it up too. So they actually on environmentalworkinggroup.org, it's a nationwide website, and they have databases where you can look up to see what is how clean or organic is this product. And you'll be shocked. I mean, it's surprising. Like I remember initially looking at Burt's Bees lip gloss and I'm like, really? Burt's Bees? Like that's their thing. I was sort of shocked. Yeah. So it's interesting. You can look at products and try to find out what's a cleaner product for you specifically. But I think there's a lot of, kids do have access, and unfortunately that also means access to misinformation or bad information, right? Instagram's a perfect example. I love when I go on Instagram and I see someone say something about, go take this collagen, and by the way, I'm selling the collagen, and I'm like, well, what's the data behind this collagen?
Exactly. Right.
So I always tell people to just check the credentials of what the person is that you're listening to. Where are they getting their information? Because if you're just selling a product because you used it and you loved it, that's very different than what is the actual data behind this.
Of course.
Yeah.
So we're towards the end of our podcast today, and we always offer our guests some time, because you've done a great job answering many, many questions, and you're like an encyclopedia as far as I'm concerned with everything to do with this. But the question really is, we want to give you an open mic moment. So is there anything that we've missed that you would like to touch on at the moment? Is there something a message you would like to share with anyone? You can even do a plug for your clinic if you want. It's up to you, but we would like to give you that opportunity.
Well, that's very nice, and I appreciate being here, and I appreciate that you had me come here to talk about everything health. We talked about men, women, we talked about kids, all kinds of stuff. I think, I see a lot of patients who come in that feel dismissed. They feel they know something's wrong, but they really haven't had an opportunity to do that. I think, finding this right chemistry is really, really important because, everybody has there's an art to medicine. There's a science of medicine, there's an art to medicine. So you have to find what makes sense, who is going to work with you on your goals, who's going to work with you on what you want to do, what the direction you find is right for you. I mean, I tell people to get mammograms. Some of my patients say, No, I'm not going to do it. Okay, you are an adult. I've given you the information. I just want you to have all the information available. And I think the biggest message for me to tell people is you do not have to suffer. You're not alone. You do not have to suffer. There is help. Don't let people kind of dismiss the way that you feel, either friends, other doctors, whoever it is. There are people that can help you, and it's just a matter of don't let yourself have to suffer.
Well, I really appreciate your time with you today, Dr. Jenn. And I'll be honest with you, I am going to make an appointment with you, and I'm going to have my generics tested because I don't sleep well either. So I was, and I don't usually go to the doctor. So thank you very much. You turned me into a believer. But on behalf of the chamber and everything, thank you so very much for everything you do. This is amazing. You came highly recommended, actually, from a lot of people in the city of Fullerton.
Oh,
there are a lot of ladies out there who think you are absolutely amazing.
Thank you.
So good job, and thank you very much.
Well, I think they're amazing too. So that's what I love about my clinic is I spend 30 minutes to an hour with patients. We get to know each other. It's, sometimes I'm a hot mess, sometimes they're a hot mess. It's all part of it. So it's okay.